Welcome to our newest episode of the Lebanese Physicians Podcast. And today we'll be discussing the Global Smile Foundation, a foundation that has a long history of taking care of cleft lip and cleft palate patients. And we will discuss it more with Doctors Usama Hamdan and Dr. Rami Kantar. Dr. Hamdan is the president and co-founder of the Global Smile Foundation. And he is currently based in Boston, Massachusetts, where he has held former university appointments with Boston University, Harvard Medical School, and Tufts Medical School. He has also started the Comprehensive Cleft Palate Workshop, which is one of the largest workshops in the world, and has people from all over the world joining it. And we will discuss it more during this podcast. And our other guest, Dr. Rami Kantar, who is currently a general trauma surgery resident at the University of Maryland and in Baltimore. He is currently close to me, but in 6 months, he will be moving to New York City, to NYU to start his plastic and reconstructive surgery training over there. And I'm sure he will do great with that. Welcome, Drs. Hamdan and Dr. Kantar, to the podcast.
Thank you for having me.
Thank you so much for having us, Dr. Diab. We really appreciate it.
Of course. I'm going to start first with asking you both. So just describe to us, because some people don't know exactly what cleft lip and cleft palate are, but what are cleft lip and cleft palate, and how does it happen?
Rami.
The floor is yours, Dr. Hamdan.
Go ahead, Habibi.
All right, Rami, you can start.
So cleft lip and palate basically consist of congenital anomalies or congenital defects in the craniofacial area. They can occur either separately or concomitantly, meaning that you can have an isolated cleft lip, an isolated cleft palate, or patients can have a combination of a cleft lip and a palate. In most cases, they occur in an isolated fashion, meaning that patients who have them don't have any associated congenital anomalies or other associated syndromes, but they also occur within the setting of congenital syndromes. The exact cause of isolated cleft lip and or palate, which is not associated with syndromic cleft lip or palate, is not known yet as of now, but there has been some associations that have been associated with the disease, including nutritional, environmental, as well as hereditary and familial factors.
Great. And so how did, Dr. Hamdan, since you are one of the founders of the Global Smile Foundation, how did the idea behind the foundation start?
GSF was founded over 14 years ago by groups of people who have been involved with outreach cleft care for over 3 decades. The key point, basically, everybody was interested in providing integrated interdisciplinary cleft care, and not the fragmented care that many of the groups do. They run into different countries, well-intentioned, but unfortunately, the damage created by many of these groups is much more than the help that's offered to many of the communities, because it is fragmented care in many ways. So Global Smile Foundation founders said, you know what, the time has come really for us to put our well-intentioned efforts together and to try to provide our patients with not only surgery, but speech, psychosocial, dental, orthodontic, and a variety of other nutritional comprehensive services that our patients need and certainly deserve.
And so your foundation consists of people from all disciplines that we just mentioned. I guess it's a multidisciplinary foundation.
That's correct. I mean, the size of the team, typically when we go to Ecuador, where we have been working now for the past 34 years, and we're entering really into our 35 years of covering that part of the world. The team is close to 60 people, 10 to 12 senior surgeons who are currently practicing cleft in their home-based area, pediatric anesthesiologist, speech pathologist, dentist, orthodontist, recovery room nurses, OR nurses, perioperative nurses, pediatric intensivists, child psychologists, photographers, so on and so forth. Plus, we also partner with people in each site. So in Ecuador, we have Fundación Global Smile Ecuador, that's well founded and fully operational there. And we have a cleft center that we established over 10 years ago that provides care even when we're not there.
And I assume it started off in one or two countries initially, right? And so which countries did it start off in first, and how many countries does it cover right now, the foundation?
It started actually in Ecuador 34 years ago, and we're currently the largest cleft provider in that country. We operate on over 50% of all the patients born in Ecuador. We cover 18 out of 24 provinces, and we have initially now 2 missions a year, each mission 2 weeks, and now we're starting a 3rd mission as well. In the last mission that we had in Guayaquil in last September, a couple of months ago, the team ended up operating on 95 patients in a matter of 8 days with outstanding outcomes. This is certainly the number that most what's done at major teaching hospitals in a year or two as well. But what makes a difference basically is our team members are all major professionals working at many of the teaching institutions throughout the country. We also have presence in Peru, where we partner with the largest healthcare provider there, Salud, that owns and runs 400 hospitals. We have been working there since 2003. We also present in El Salvador at the Children's Hospital in Benjamin Bloom. And we've had presence in Guatemala, Brazil, and many other Latin American countries. We also had missions in West Africa that we stopped in 2015 because of the security situation. So we've covered Ivory Coast, Burkina Faso, Niger, Senegal, so on and so forth. And 2012, we started in Lebanon. What started a small mission with 3 patients has grown to become now 2 missions a year. We're the largest cleft provider in Lebanon as well. We're operating in over 50+% of all the patients born there. Whatever your nationality is, as long as you're needy, you come through the door, we provide you the care for free, irrespective of color, background, religion, nationality, whatever basically that part of the world is usually involved with all these divisions. So we typically, right now, our population is a large number of it is refugees population, as well as patients from the whole North Africa as well, plus Lebanon, Palestine, Syria, Iraq, so on and so forth.
They all come to Lebanon for the care that they get.
Yeah.
Okay.
Yeah, we work with some of the large institutions, NGOs like UNICEF, International Committee for the Red Cross, United Nations High Commission for Refugees, Special Olympics International as well. So they refer the patients over to us, along with many of the local NGOs as well.
And how many patients have you treated since the foundation started, I guess, all over the world?
As you can tell from the numbers that we do an average of 350 surgical cases every year, an average of 1,500 patients per year at all the locations. So if you do the math times 35, we've taken care of thousands of patients. The more important thing, really, Khalil, is not the impact on these patients; it's the impact also on their life, on their family. I'll tell you 2 simple stories. We went down to Ecuador in 2004, and I had an Argentinian Ecuadorian team member with me. And we saw in one day 354 patients. And she said, I lived in this country for 15 years. I never saw a patient on the street with a cleft lip. I said, because they're hidden at home. And because people are ashamed of bringing their family members out. That requires 3 to 5 family members to take care of every child or adult who is being hidden at home. We started in Lebanon in 2012 with 3 patients. We barely found patients to operate on when we first started, and they started coming out of the woodwork. And it turned out actually Lebanon has 4 times higher incidence of cleft lip and palate than anywhere else in the world. 1 in 422 compared to 1 in 15 or 1600. The reason for that, as Rami eloquently mentioned, basically lack of folic acid, consanguinity, maternal diabetes during pregnancy, exposure to smoking, so on and so forth. And unfortunately, the numbers are staggering, but they end up also hiding them at home, which unfortunate because it's depriving the society from 3 to 5 fully functional members of the society that can really make a major contribution. And Rami, why don't you update Khalil a bit on the social and financial impact of the study that you recently published in the Craniofacial Journal?
Absolutely. So another thing that I think is worth mentioning, Dr. Diab, is that I feel like what separates us from other foundations and other nonprofits and other not-for-profit organizations is that we're very critical about our outcomes and making sure that we're evaluating our outcomes in a longitudinal fashion to make sure that we're implementing the change that we need and that we want in the areas where we operate. And part of that assessment and analysis that we do is a clinical assessment of the burden that we've alleviated for our patients over the last decade or so since we started operating in several countries. And in one recent study that we published not too long ago, we basically calculated what is the economic burden that we are sparing every patient with primary cleft lip or palate that is alleviated by a cleft lip or palate operation. And we found that number to be between $40,000 to $80,000. And as Dr. Hamdan mentioned, during every mission, we treat anywhere between 80 to more than 100 patients. And that is only counting patients who undergo primary cleft lip or primary cleft palate repair, the surgery itself, and not counting the speech associated with it, the dental treatment that the patients get before the surgery that optimizes them to get to the point where they are as prepared as possible to get the surgery, in addition to all of the dental work that comes after that. And you can imagine if you multiply the number of patients that we've treated over the last decade plus by $40,000 to $80,000 per patient, then that amounts into several $1 million of spared economic burden for these patients and their families, which they can invest in alleviating themselves from their poverty and their poor social conditions, which is most of the areas that we operate in.
Yeah, and that is, I guess, because these patients, if they're not operated on, they tend to stay home and then have family members take care of them. So basically, it's a double economic burden because they're not functioning economically, and then their family members are not functioning to full capacity because they have to take care of them.
That's correct. And the other problem as well, Khalil, is the substandard care that's being offered to many of the patients who end up actually seeking care from unqualified people and ending up with lifelong facial deformity that many of us can't even correct. So what we've been trying to do are two things. One is educating the public that if you want to seek help, seek help from somebody who's well trained and also someone who knows their limits. I always keep telling my fellows, you need to figure out what your limits are as a human being and as a surgeon to make sure that you're not inflicting any damage on the life of anyone. And we see, unfortunately, a lot of cases that are being mishandled, especially in the Arab world right now, in countries that have been involved with the current war, Syria, Iraq, Yemen, and many other places. My understanding, some places actually patients are being operated on by urologists. Anyone who comes in through the door, the patient is going under the knife. So it's crucial for us to increase the public awareness about the availability of care by well-intentioned and well-provided and well-trained groups like ours, and to avoid basically care being provided by people who might not be able to help their children in the right way, because the cost of correcting these deformities on the long run is astronomically so high, not to mention the psychological trauma that these families have to go through.
And I think as Rami mentioned to me before the interview that, and you mentioned to me too, is that the foundation not only does the surgeries and does the multidisciplinary care, but also provides like comprehensive care afterwards, and also provides training to some of the local physicians for appropriate cleft lip and cleft palate care afterwards, which, as you mentioned, probably is important because then you have physicians on the ground who can help these patients too if the foundation is not there.
That's correct, actually. And because, again, there's nothing like empowerment of the local talent. I was giving some lectures at the World Congress in Chennai in 2017, and 2 Afghani surgeons approached me and said, would you be interested in coming to Afghanistan to train us? I said, I don't think it's the right idea, for me to be going to Afghanistan. And but let me at least, this is actually the idea how it came up to develop the Comprehensive Cleft Care Workshop. So the first workshop was held in Lebanon in 2018, and the Global Smile Foundation invited these 2 Afghani surgeons at our own cost and paid for the airfare, accommodation, visas, everything, registration fees. The workshop was attended by 90 cleft providers from, I believe or not, 27 countries. And the concept actually behind this workshop is it loops back into the same continental area every 3 years. So you don't get bored with us every year. And at the same time, we're bringing the world authorities in the field to lecture. So you're not being trained by people who are kind of novices in the area. 2019, we held our workshop in Latin America. The numbers doubled to 180 people from 37 countries. Chennai, India was supposed to be in 2020. Because of COVID, we converted into virtual, but the numbers shot up to 302. And very happy actually that our workshop in Istanbul, Turkey, last month we had 489 registered from 68 countries. 200 or so actually were in person and the other were virtual. And this is really the power of education and training for us to be able to help people who need this kind of care. Somebody reached out to me from Portugal a couple of days ago. They have a very kind of intractable case that they saw being, the treatment option at the workshop. And they said, we're learning how to actually tackle some of these issues at the workshop. Otherwise, we would not have been able to help our patients on the ground, even in Western countries like Europe and things like that. So again, the power of education and training is quite significant. For every trainee, if you see an average of 200 patients a year, you're impacting the life of almost 4,000 patients in 20-year practice. So if you had around 500 attending the workshop, you're talking about almost 2 million patients impacted in it, almost a 20-year period. And this is the power of education and training.
Right. And talking about training, looks like also surgical trainees are involved in the foundation. And I think we have an example here, Rami, who's been involved. So Rami, how did you get involved with the foundation? And can you tell us a bit about your experience and what you learned from it?
Absolutely. So I initially moved from Lebanon to the United States to Boston, where I did a research fellowship at the Mass General Hospital, Harvard Medical School in oncology, thinking at that point that I wanted to go into surgical oncology. And then shortly before starting residency, about 6 months before starting my general surgery residency, I met Usama and got involved with volunteering with Global Smile Foundation. And that's been almost a decade ago. And it's been an amazing journey since then. Throughout my time with the foundation then, I've been involved initially as a volunteer, started off as a mission coordinator by volunteering with the foundation, went on a couple of missions as a photographer. And then as I grew through my surgical training, I was fortunate enough to be able to assist with some of these operations. And as Dr. Hamdan mentioned, all of the operations are done by board certified plastic and reconstructive surgeons or cleft surgeons or otolaryngologists who do this on a unique basis in their daily practices. And it's very unique for us as trainees, both international trainees from the United States, but also local trainees at the sites where we operate, to be involved and to participate in these operations and to see how these operations are done, to ultimately translate that into our training. I was also fortunate enough to be involved with mentoring our research fellows, organizing the educational workshops, and I'm just very happy and proud with how much we've grown over the last decade. And as Dr. Hamdan mentioned, we started from 100 participants in our Beirut workshop to 500 participants in our last workshop in Turkey. And again, to go back to the point that we made about the missions, which is the importance of being critical that we're achieving the outcome that we're setting off to do in the beginning. We also do that with our workshops. And so at the end of every workshop, we critically analyze and assess what the participants' experience was. And we've been fortunate enough to gather and generate very interesting and very encouraging data that shows that participants in our workshops are not only pleased with the educational content that they're getting through the workshops, but have predominantly and the majority reported that they would participate again, recommend their workshop to their colleagues, and also reported an impact on their clinical practice about 6 months to 12 months down the line, meaning that hopefully we are creating that ripple effect in the cleft community that Dr. Hamdan was mentioning.
Yep, and hopefully that will be seen in the multiple countries that these participants are coming from. And do you have any, can you share with us some patient success stories? Because I know it's been operating for many years now. So patients who have been operated on and who are grown-ups now, and their stories after having been treated for cleft lip and cleft palate. Dr. Hamdan, you're muted.
Sorry, I said every patient has a story, and it's amazing how once you scratch the surface, the impact that you can have on the lives of these patients. Can you see the screen?
Yes.
All right. So way before COVID, people have been using face masks to hide their facial disfigurements, like this patient, and they walk around the street. This is somebody from Mali from 2007, 2008. And I always say, imagine living all your life like this, year upon year, from India to Africa, and completely stigmatized and hiding in your own home because nobody has been able to provide you with the proper care that you much need. This is the quality of care that we try to provide our patients. This is Mateus, a Venezuelan refugee whose aunt called the mother in Venezuela from Ecuador and said, the American group is here. Why don't you bring Mateus and come over? Mateus is a preemie, was born at 32 weeks and was underweight. We could not operate on him because of significant malnutrition. One of our board members and Fundación Global Smile Ecuador contributed to providing him with the formula for 6 months. And then we came back in September of that year, and we were able to do the surgery on him. And actually, we're writing up this case in the literature because of the way that has been handled to provide the premaxillary setback and the surgical outcome. 2 to 3 hours of surgery and with the minimal overhead can really impact the life of so many patients. We have probably some of the longest follow-up of patients throughout the world. We proposed last year the first roadmap on developing sustainable cleft care, where augmented reality is part of this thing. These are my 2 fellows doing surgery in Ecuador, and I'm guiding them from my office in Boston, 3,500 miles away. And this is the workshop component as well that I was just telling you about, where each one has their own model and are being mentored by some of the world leading physicians. This is where we started in 1987 and into the current size that we're at right now between Ecuador and Peru. And the size of the team is quite significant. This is the presence where we are in various parts of the world. The orange ones are the active sites right now. And in Ecuador, we have patients coming in actually with the echo. We provide them with the prenatal counseling and the psychosocial support. And then the baby is born, we provide them with the right feeding bottles to enhance their feeding. Our website has also all the resources that the families need for that. A lot of psychological trauma that the families have to put up with, so they meet with our child psychologist. And then we provide them with the pre-surgical orthopedics, dental care, the surgical care throughout, speech therapy as well after that. And this is just an example of some of the patients that we have been taking care of. These are, again, some of the setback techniques that we have described in the literature. And Global Smile Foundation has the largest series in the world for this kind of surgical management of these patients. We do 4 surgeries in one Khalil that allows us basically to provide this kind of outcome for these patients. And we follow up the patients year after year. This is Karim from Beirut, whose lip was done, followed by the cleft palate, and Aya as well from Beirut. This young man, basically the mother, he was born in a small island in the Amazon in northern part of Brazil. The mother gave him up and left the father. The father brought him up with the help of a 70-year-old female neighbor who's almost like a grandmother, who took care of him. They found out that we were coming to Macapá, which is literally in the northern part of Brazil, right next to Suriname. And they canoed for 3.5 days up the Amazonian River until they reached Macapá, and we were able to provide the surgery for him. That's why I was telling you, basically, every patient has a story. And it is amazing. You can see basically, and it has been, this is like 3 days post-op, and you can see the smile on his face and how ecstatic he is to have it done. This young gentleman, Mamadou, basically came to us 2 years later in Ivory Coast, and he said, I go to school now, and my classmates don't beat me up. They don't make fun of me because I don't have a cleft lip anymore, and I'm able to integrate better into my class. Lean, one of our first patients in Lebanon, 10 years later. Marciano, 57-year-old, done under local anesthesia. And the wife came to me in the recovery room and said, thank you, my husband just gave me my first kiss in 30 years of marriage. So even the simple thing that you take for granted of hugging, kissing, basically many of our patients basically lack this kind of pleasure to be able to share with their loved one. All these are patients of ours that we've been taking care of since 1992. They have grown up to be a young adult men and women in medical school, in law school, and Freddie is in law school, almost 23, 24 years later. Yahaira is 30-year-old. This is among the longest term follow-up in outreach setting that any of the groups have. And Haura, basically, this is, we always say, the power of transformation. You can see basically, she's from the northern part of Lebanon. And you can see the transformation over the course of 7 years, how she has grown to be, this kind of stunning young lady, basically. And the gentleman who did this video is no one but Diego, who was also a patient of ours from 1996, and he's now on our payroll. And he's our photographer and travels with us all over the world. So this is really basically the ability to share your know-how and your goodwill and make a difference in the life of others and make this a better place, irrespective of nationality, color, background, religion, because at the end of the day, we're all, one human being and one mankind, and we need to take care of each other.
Right. And these pictures, show how much these patients' lives has changed actually by doing these surgeries. it's a big change before and after the surgery that we just saw right now. And I know your foundation just came from a visit to, or from a mission in Lebanon recently. Can you tell us how that was and what the needs in Lebanon are right now, especially given the economic conditions over there?
I mean, it was disheartening because I've never seen the country facing so many difficulties, a lot of shortage of medications. We had to bring in medications from Turkey, from Turkey, India, Mexico, Colombia, and the United States, just to be able to provide some of the much needed care for our patients. Economic situation is pretty bad throughout, and my heart goes out to many of the people over there. On the positive note, we were able to take care of 29 patients. We ended up actually operating on these patients with outstanding outcomes. I was very happy with the results, and I will share with you the trip report from that mission. So this is literally fresh out of print. 34 years in outreach cleft programs and 10 years of cleft program in Ecuador, in Lebanon. We saw 61 patients, 31 surgeries on 29 patients, 80 oral hygienes. And this is the team. And AUB sent 7 of their plastic surgical residents and 3 of their pediatric residents. And St. George, Lebanon, sent 1 of their ENT residents to work with us as well. Plus, we had a lot of dentists and orthodontists from LAU, BAU, and many of the other dental schools and the universities. This is Sharafuddin, and this is immediately post-operatively. Soraya, and you can see also the transformation, the beautiful girl who will have the chance to have a perfectly normal life as she grows on. Abdulamin as well, and Anas, Ammar, Mirna, Aline. Aline's mom broke down in tears. She said to me, my daughter was born today. My daughter was not born 4 months ago. I can now take out my daughter anywhere. I won't feel ashamed. And her siblings can hug her and kiss her and they won't feel estranged. And again, this is the power of transformation that you can see in a matter literally of 2 hours. And the impact that psychologically that these facial clefts have on the life of so many of our patients. And as you can see, basically, I'm very happy with the outstanding outcomes that the patients ended up having. And we followed up many of the patients who came in. Kareem already had his lip and palate done, as well as Tabit. Mila had her palate done on this mission. Ali as well. And so we tried to do their lips and then follow up with the palate. And at the age of 15 to 20, we do their primary cleft lip rhinoplasty. So this, we ended up operating for 4.5 days. And we're looking forward to our next mission in April. We have a full schedule for April and November, believe it or not. What we're lacking really is well-intentioned people to help the foundation to cover some of these surgeries so that we can continue to provide care for these patients.
Yeah, that was my next question. Actually, these are all powerful images and powerful work. And how do you continue to get your donations and who sponsors or who are the sponsors for the foundation?
Both individuals and corporations. In Beirut, also we partner with Smile Train, who also help with our mission. We partner with some local and international NGOs. But at the end of the day, really, it comes down to many of our friends, family members, board members, colleagues who adopt 1, 2, 3, 5 surgeries at a time. It costs us an average of $1,500 to provide a cleft lip or palate repair. The patient pay 0. We take care of all the hospital charges. We send them home with painkillers, with antibiotics. So they come in, they get the care done, and they go home basically at no cost to them. And again, with the highest quality care. So we hope that, again, people will just go and kind of reflect back on, should I, buy a couple of cups of coffee at Starbucks, or can I, save, 30, 50 bucks a month and cover for the surgery of a child, and put a smile on a child's face. And yeah.
And the way to donate is through a website, right?
That's correct. Yeah, through gsmile.org. Yeah,
it's pretty easy to find. And so, what are the future plans? I guess any future plans of expansion, or with the workshop, or with the missions?
So our schedule basically is the following. January is El Salvador. February will be in India, checking out the site for our workshop in 2024, because the workshop basically is already set up all the way into 2025. March, we have a 2-week mission in Ecuador, barely come back to the States, and then we have a mission to Lebanon, with only 1 week rest. And then we have a second mission to Ecuador, because we've been invited by the Santa Elena province to have another mission there, different from the one in the Guayas, followed by mission to Peru in May. And then we are presenting 10 papers or more at the World Congress in Edinburgh in July, followed by the 2-week mission in Ecuador in September, followed by the workshop in Rio de Janeiro, which now we're expanding into 3.5 days. And we're expecting close to 500 people from Latin America, with 70 world leaders who are speaking from 20 different countries. And then followed up with a 1-week mission to Beirut in November. So that's the schedule for 2022.
That's a hectic schedule. I mean, I feel tired just listening to
it. Wait until you start packing and unpacking and putting together 15 suitcases and shopping up to the airport, and then getting them through customs and getting them into the hospital and taking care of the patient and PCR testing every patient and their family member and getting them in, and then providing them with dinner. But that's what we typically do to ensure everyone's safety. We have had zero breakdown in COVID cases since we started our policies, and we published actually our experience so far. That's now being used as a guideline by many other international NGOs. So the patients come in every day, where they get PCR tested in the morning. And then once the results are out, those who are negative, we get them into the hospital at our own cost. And then we provide the family with dinner. And then the second day, they get screened. They cannot leave the hospital. As soon as they walk in, we will provide them with any of their needs outside the hospital. Then the surgery is done the following day, and then they get discharged, the following day. So like a 72-hour stay. And then this goes on day on, basically one after the other. And then you're done usually by Friday with low black tie dinner, so people can enjoy themselves, and then you're back home by Sunday. So that's a typical 1 week or 10-day mission, and you can multiply that by 7 or 8. So anytime you want to help Khalil, you're more than welcome.
Yeah, for sure. I will contact you.
Yeah.
And Rami, any words of advice? Any final words of advice for trainees who think about joining the foundation and helping out with it?
Absolutely. I guess the piece of advice I have is, if you are considering joining an organization, definitely think highly of Global Smile Foundation. I can only speak positively and very highly of the experience I've had over the last decade. And so I'd highly encourage anyone who's interested in the field to reach out to us, get involved, get in touch. And the other overall general piece of advice I have for medical students, residents, trainees who are interested in global surgery, whether it's in cleft surgery or other, is to do it for the right reasons, and not to feel overwhelmed about getting involved in these initiatives, which is what I initially felt when I started getting involved and started traveling. I think the important thing is to commit and to engage in these initiatives in a longitudinal fashion. You can start small. I started with a local fundraiser before traveling with the foundation, started as a photographer before starting assisting with the surgical procedures. So I'd highly recommend to think of the commitment as a longitudinal capacity building commitment rather than a one-time type of deal.
Yep, great advice. And Dr. Hamdan, any final words?
Basically, I just second what Rami said. You need to ask yourself, what am I doing on the face of this earth? B, you need to be able to share your blessings with others. C, you need to ask yourself every day, what did I do to better someone else's life today? From the minor thing of stopping your car to let someone cross the road, to helping open up door, to do surgery, to donate, to whatever. The pleasure is in the journey. It's not getting to point B and to point C. Enjoy every single moment of it, as Rami said very eloquently, and enjoy the pleasure of changing other people's lives, interacting with well-intentioned people like yourself and well-minded people as well. And at the end of the day, you look back and you see how much enriched your life is, as well as how much you've enriched the life of others as well.
Yeah, that is very good advice, and I think we can see it through this podcast today. Just with this starting as a small foundation initially, and it has grown so much over the past 3 decades to serve thousands of people at this point and change their lives. So it was great talking to you both and great learning a lot about the Global Smile Foundation today. Thank you.
Thank you so much, Khalil, for your kind invite, and thank you, Rami, as well, for all your wonderful leadership.
Thanks a lot for the opportunity, Dr. Diab, and thank you for everything over the last decade and more, Usama. I really appreciate it.
Really.
Thank you.
Be well. Take care. Thank you so much.